Understanding the Role of Information Technology in Nursing by Brittany Pike, University of Kentucky. Practicum setting. In my practicum, I worked with the Clinical Acute Workflow Lead at UK Healthcare's Information Technology Department. UK Healthcare is getting an entirely new medical record system in 2021, so the Information Technology Department is working on the implementation of the new upcoming EPIC system. So the setting of my practicum changed based on my preceptor's workflow needs for the day. Several days of my practicum involved attending work groups for various disciplines. These work groups included nurses, physicians, respiratory therapists, and other clinicians to just get updated on the changes that were coming with EPIC, how to do basic charting in the new system, and these people are going to go on to become super users in the EPIC system when we implement that hospital-wide. Other days took place at my preceptor's office in the Information Technology Department. These days involved various activities, such as sorting through features of the upcoming EPIC system to understand various workbooks, and if those specific workbooks should be integrated into the University of Kentucky's electronic medical record system. This slide contains two images. One image is the Information Technology Department and its organizational chart and how that department is set up and who each person works with and how those departments are interconnected. The second image is the roles and responsibilities of the workflow lead. During my practicum, I was working in the clinical acute section of the department with the workflow lead. This section included staff from various departments that are in acute care. The teams consist of nurses, physicians, respiratory therapists, pharmacists, various other disciplines. Each brought their own experience and knowledge to the interdisciplinary team, which allows the department to ensure that each discipline is getting their needs met when the new electronic medical record is implemented. Learning goals. So before I started this practicum for this class, I had no idea what information technology really did in regards to nursing, other than just the electronic medical record that we chart in. But I didn't really understand what those who worked in that department did and worked on, and kind of the behind the scenes stuff from there. So really, I wanted my learning goal to be related to that kind of knowledge deficit. And I wanted to evaluate how information technology in nursing improves patient safety and incorporates the nursing process to improve patient outcomes. And I also just wanted a better general understanding of the role of information technology in the healthcare system, and especially how that relates to nurses. So again, I didn't understand information technology in relation to nursing, and I really wanted my learning objectives to reflect the learning goal of better understanding a nurse's role and how information technology supports our job at the bedside as well. So my first learning objective was to identify 3 ways that nurse workflow can be improved with implementation of a new electronic medical record system. Secondly, I wanted to evaluate how information systems support the nursing process and safe and effective patient care. And I also wanted to discuss educational needs for the nursing staff regarding implementation of a new electronic medical record system. That's just a really big task, and I feel like there's so many areas that nurses need education on, especially since we tend to be kind of resistant to change. So I just wanted to better understand our educational needs in that regard. Best practices. I really wanted to address best practices in 2 different ways. One with the implementation and the best practice for that, and then the other for best practices regarding the actual electronic medical record and inclusion of things that should be in that. So Bentley et al. Sought to explore how complex organizations such as hospitals approach the specific problem of technology adoption in a transition from one paradigm to another. They identified 5 phases of electronic health record implementation. Pre-contemplation phase is where the organization really just starts identifying that maybe this isn't the best electronic medical record system. Maybe there are some improvements. What are other people doing? Planning groups are formed in this stage. Contemplation. In the contemplation phase, the planning groups really make a framework for decision making and how they're going to move forward in selecting the right electronic medical record for their hospital. Preparation. This phase includes assessing the enterprise's needs in the electronic medical record and ways in which the current electronic medical record is not meeting those needs. It's really getting into that information and really just picking it all apart. The preparation phase involves selecting electronic medical record vendors that best suit the needs of the hospital. So this is the phase that you're going to select whoever you go with. In UK's case, we selected Epic in the preparation phase. The action phase is the phase that I was involved in my practicum setting. This phase involves training staff in anticipation of the go live date for the new electronic medical record. It involves training various workflow groups, and I was involved in training Epic super users. This phase also involves the actual go live transition, which is anticipated to take place in the summer of 2021 at UK Healthcare. The maintenance phase involves assessing how the new electronic medical record is functioning once it's implemented. This phase really involves refining workflows and enhancing the system in ways that may not have been addressed or even anticipated before the go live date of the electronic medical record. So this will take place sometime after 2021 for UK Healthcare, and it lasts really continually. It's not something that you stop doing once you've implemented your system. So best practice for an electronic medical record in general, there's so many things that you could talk about here, and what should be included, how to use that electronic medical record. So I just chose some ways that I thought were very pertinent to nursing and things that I've seen before as well. So real-time data collection and alerts related to that data is best practice for an electronic medical record. One area that interested me was related to sepsis. I've personally taken care of patients that sepsis was not recognized as early as it should have been, and just seeing the poor outcomes related to that late recognition of sepsis. So I found this information especially interesting. Naranian et al. Found that when an electronic medical record had the ability to include a pop-up alert when a patient met sepsis criteria, that time to antibiotic initiation was decreased and length of stay was also decreased in those patients. Quicker implementation of therapy and length of stay reduction is a direct result of better electronic medical record functionality. It allowed nurses to see the problem even if they couldn't put all of those pieces together on their own, which sometimes happens. According to Walker-Sizes, nurse-sensitive indicators were impacted by the adoption of electronic medical records, so CLABSI, CAUTI, ventilator-assisted pneumonia, falls, and hospital-acquired pressure ulcers were all studied in this research, and they were all reduced after implementation of an electronic medical record that catered to nurse-sensitive indicators. Some of these indicators had an increase in the immediate implementation period, but they were followed by a significant decrease once staff became used to the electronic medical record. That included pressure ulcers and ventilator-assisted pneumonia. They were both within that category. So best practice for an electronic medical record is to include careful consideration and inclusion of nurse-sensitive indicators, oftentimes with an alert to staff regarding the nurse-sensitive indicators, such as a high Braden score or a high fall risk, and not allowing staff to move forward with the charting if those things are not addressed. So a forced stop is one of the best practices for those indicators. My practicum site is effectively utilizing information from the literature to guide their electronic health record transition. This is obvious in the use of the 5 phases of implementation. Staff can follow along with each phase on the information technology intranet site. UK Healthcare has allowed staff to voice opinions and concern along every phase of the implementation staff. Staff were invited to meet with representatives in the contemplation phase of implementation. They were asked to speak to these representatives about various electronic health record from various electronic health record companies and to provide feedback about each of the options. This was before they chose Epic. UK Healthcare has been transparent about this $300 million undertaking and has valued staff input along the way. Additionally, research has shown that simulations are ideal learning environments for clinicians being trained for a new electronic medical record. This allows clinicians to utilize the medical record in a way that will be natural at the bedside for them. UK Healthcare is hosting numerous electronic health record simulations to ensure adequate staff familiarity with the new system. Things such as real-time code charting will be trained in a simulation setting. UK Healthcare is encompassing the current literature in regard to real-time data collection, such as mentioned earlier with the real-time data collection in relationship to sepsis. Real-time data collection will also be available during bedside procedures and codes and things like the interoperability of the IV pumps that was mentioned earlier. Also helps with real-time data collection. UK Healthcare is also utilizing alerts for nurse-sensitive indicators. The new electronic health record is designed to alert staff when it is time to turn patients or that a patient is at fall risk. I think also suicide risk, things of that nature that are alerting staff and giving them hard stops with interventions that need to occur when the patient meets those criteria. I feel that I really accomplished my learning goals and objectives with this practicum. Before I started, I was unsure of what this experience would entail at all, what nursing information technology looked like, and I honestly didn't have any idea what my preceptor's job was or what a workflow lead did during the day-to-day hours. So I definitely have a better understanding of that now. I also have a better understanding of how information technology really utilizes the nursing process. It's the same system. It's assessment, diagnosis, planning, implementation, and evaluation. You're just utilizing that for your actual medical record system as opposed to directly on a patient and their healthcare needs. I see how information technology utilizes the latest evidence-based research to determine what information is going to be included in the electronic medical record. Sometimes these workflows are included because evidence-based research shows that those inclusions will lead to better patient safety outcomes, things like a sepsis bundle alerting nurses when signs and symptoms of sepsis have been charted, and then it alerts nursing staff that, hey, you've charted these things, maybe you should think about sepsis in this patient. Oftentimes, information technology is utilizing evidence-based research to ensure that the jobs of clinicians are easier and more effective, such as the interoperability between IV pumps and the electronic medical record. This allows nurses to program the pump simply by scanning the patient band and the medication. This ability to communicate also automatically enters IV medications and fluids into the patient's input flow sheet, so it creates less charting for the nurse, less programming of pumps for the nurse, and has been shown to decrease some IV medication errors as well. I think moving forward, I'll have a greater appreciation for the work and evidence-based research that does go into creating an effective electronic medical record. This experience has also allowed me to consider some ways that I can utilize my critical thinking skills that aren't directly at the bedside, should I ever want to leave direct patient care, but also still have a big impact on patient safety, patient outcomes, and the day-to-day lives of nurses working at the bedside.